Hi, I'm Dr. Gentner. I practice chiropractic and applied kinesiology in Cadillac and Okemos, Michigan. We're making this DVD today to help some of our patients understand the types of treatments and procedures we use in our practice to help severe and chronically ill patients regain their health and get back to a better balance. The applied kinesiology procedures we use, at the level we use them in a very advanced approach, is almost like I know another language. With this language, I can ask your body questions and your body can give me back answers. With our muscle response testing, we get either a strong muscle response or a weak muscle response. We get a yes or no answer to our question. We don't get an essay question back answer. So, like any other language, we must A, ask questions properly, and B, interpret answers properly to make sense of the information we're gathering. With the chiropractic part of our work, we first want to make sure that the brain is talking to the body parts and that the muscles are responding to normal nerve impulses. We will test different muscles in different positions, different directions, to make sure the communication networks between brain, spinal cord, and muscles are all proper. Once all the muscles are balanced and properly aligning the structural system, we will use muscle testing to evaluate joints. I tell all my patients that as a chiropractor, I am convinced all joints are designed for motion. That's what they're there, to move. But they should not move so far as to move out of place that can cause us pain or dysfunction, yet they shouldn't lock up so tight they don't move at all that causes pain or dysfunction. So, as chiropractic spinal analysis, we're always looking for that happy medium. Motion in the joints, not too much motion for dysfunction, yet not too little motion for dysfunction. I'm also convinced that the body is a healing machine. The body is designed to heal and correct itself at all times. It's designed by the big guy upstairs to always fix whatever it needs done. We see patients who fight chronic illness and chronic problems for long periods of time. In these situations, the body has developed irritants or reactions to certain substances or certain other problems that it cannot learn how to overcome and heal itself. With our work, we want to identify in phase 1 as many irritants as possible that are causing the body to not be able to heal itself. These types of irritants have to do with spinal misalignments and chiropractic structural imbalances, including cranial and craniosacral imbalances, reactions to substances like viruses, bacteria, fungus, yeast, parasites, reaction to metals and chemicals, reaction to other environmental irritants and allergens, stress responses, and emotional reactions and post-traumatic stress responses. These are the categories of irritants you're going to be looking for in what I call phase 1, where we identify these irritants, make as long a list as we can in our initial evaluation of the things the body's not been able to overcome itself, and then we go through our work to either correct or remove these. Each one of these will be demonstrated as we go along. Once we've covered these things, phase 2 of our work is building the body back up. And at the end of our video, you will be able to see a little discussion on phase 2, building the body up. But for the most part, we want to concentrate on the various classic irritants the body is not be able to correct itself.